that snowstorm that's wreaking havoc around much of the country is also throwing a wrench in the coronavirus vaccination efforts, with vaccine appointments on hold across the Northeast. Over the weekend, the United States passed 26 million COVID-19 cases. Here with the latest on that and the vaccination efforts and more, Dr. Ashish Jha. Dr. Jha, of course, Dean of Brown University School of Public Health. Dr. Jha, always good to have you, sir. Thanks for your time this morning.
Thank you for having me on.
So you had this really interesting thread on your Twitter account this past weekend, and I want to call attention to it for our viewers and listeners, because you were talking about the importance of global vaccination efforts, noting that if variants run rampant, it could lead to a never-ending pandemic. Why is it so crucial, Dr. Jha, for other countries, not just the United States, but other countries, to get fully vaccinated as well?
Yeah, so, Greg, the idea here is that what we're seeing is variants come out of countries where outbreaks are really large, like Brazil. And I can imagine a future. Imagine vaccination goes really well here, and everybody in America is vaccinated by the summer. And then there's some variant that comes out of Brazil or India or somewhere else and takes off and is actually resistant to one of our vaccines. Then we're going to all of a sudden find ourselves with a population that's vulnerable again. And we're going to have to build new vaccines again and revaccinate everybody. And I want to be done with this thing.
Tell me about it.
And the way we're going to be done with this is to stop outbreaks everywhere, because the world is all interconnected. We live on one planet, and we know is that a variant that arises anywhere can threaten people everywhere. So we got to have a global strategy, not just an American strategy.
That's good perspective. I want to ask you, everybody was buzzing about this weekend. So we reported on Friday, Johnson & Johnson says their vaccine is 72% effective. And then they say in preventing symptomatic COVID-19 in the U.S. That's compared to 95% for the Pfizer vaccine and then 94% for Moderna's. Are these vaccines sufficient protection against new variants? And you have a lot of people who are saying, well, I don't want the one then that has 66% effective or 72%. I want the full one. And it was so interesting to me to hear this weekend people trying to figure out how they could get the quote unquote best one. Is that a concern?
You know, it really isn't. People have to understand that when you look at the data, I mean, there are two parts of it. First of all, Johnson & Johnson was testing its vaccine in South Africa while the variant there was happening. Moderna and Pfizer never did. So I think that that's one reason why the Johnson & Johnson numbers are a little lower. Second is, what do we really care about? What we care about is not the infection. What we really care about is getting sick, hospitalizations, and deaths. And all the data we have right now says the Johnson & Johnson vaccine is terrific at preventing hospitalizations and deaths. So I would feel very comfortable taking it. I'd feel very comfortable having my family members take it.
Okay.
I think we have to keep our eye on the prize. That's what matters.
Okay.
So, Dr. Jha, over the weekend, the World Health Organization saying that pregnant women may be vaccinated safely if they choose. Are there risks? Should women who are expecting be concerned about this, taking the vaccine?
Yeah, WHO flip-flopped on this, and I thought that was a little bit unfortunate. Look, there is no reason to believe that this vaccine is going to be unsafe in pregnant women. The problem here is that we haven't tested it in pregnant women, because obviously doing clinical trials in pregnant women can be a bit more of a challenge. But everything we know about the vaccine and pregnancy makes me think this vaccine should be safe. And certainly women who are in high-risk situations. Imagine women who are nurses and doctors on the front lines. If I were their doctor, I would recommend that they get vaccinated.
Dr. Ashish Jha. Dr. Jha, thanks as always, sir. Thank you. Thank you.
Thank you.
Hey, thanks for watching our YouTube channel. Find your favorite recipes, celebrity interviews, uplifting stories, shop our favorite deals, and so much more with the Today app. Download it now.